Hello, everyone. Autoimmune plus early menopause has been on the rise amongst women. We are going to talk about this topic with Dr. Inge Wetzel, who is a board certified naturopathic doctor with specialization in thyroid and adrenal disorders. I am Amita from Nourish Doc, a global platform for natural and holistic therapies. I am really happy to introduce all of you to Dr. Inge Wetzel, who's joining us live. Welcome, Dr. Inge.
Thank you so much, Amita. And yes, we have everything out of the way and we are functional. So if you are ready, I am ready.
I am ready. We've had some technical issues and we apologize for a 15-minute delay. So we are ready to get started. Yes, absolutely. Okay, please get started.
Thank you. So lupus is on the rise, and there is a lot of research between lupus and hypothyroidism. So an association between those two has been reported literally for more than 50 years. The laboratory numbers, when you go to a doctor to get tested for thyroid, has been adapted to the average American who goes to the doctor during the year. So if people, for example, in the Midwest, a large portion of the Midwest is exposed to high levels of radon in the ground. Radon affects your thyroid function. So people who have thyroid problems and live in the Midwest, they go to the doctor and their numbers are normal. That means normal for this type of population with all the same problems. Doesn't mean you don't have a problem, but medically it is considered a normal average. And I want you to understand that because there are just 3 control groups in the United States, and all of the United States has radon in the ground. That is just something that is part of nature here. But the highest concentration is in the Midwest, and it definitely affects your thyroid. So as Americans become unhealthier, the problems that we pass down to our children and pass down to our grandchildren, and it goes on with the generations, and every generation is then born with somewhat of a problem. They get exposed to the radon. They get exposed not just to radon, but also environmental factors and chemicals in the air that affect our thyroid function. Then that becomes the normal. So Americans get unhealthier every year, and the laboratory numbers are adapted to the unhealthier generation, the baby boomers getting older. So prevention becomes more and more critical to maintain your quality of life, so that at age 65, you're not taking 2 pages of medications, as I see walking in my office. And then people have no quality of life because all the side effects of their medications. So let's take a look at the next slide here. Thyroid cancer is twice as prevalent in patients with lupus compared to those without lupus. It causes lots of complications in pregnancy, miscarriage, the edema, lots of different things that pop up. And again, there is usually a damaging after effect after pregnancy. When you are pregnant, the child also needs thyroid hormones. And so your thyroid literally has to produce for 2. Well, in the meantime, you already have an underactive thyroid. And so the effect on the baby is even worse. And you see babies born that have loss of hearing, blindness, things like that, all due to environmental factors and improper circulation, because your thyroid controls every cell in your body. There is not one cell in your body in any organ that can function without thyroid hormones. And people don't take any support for their thyroid while they are pregnant, even though there is so much stress on that organ. So then women are at higher risk for autoimmune than men. So you see here that women have 17% higher risk for autoimmune diseases than men. Most doctors never even test for it. People that walk in my office with all these problems, I'm asking them for blood work they've had done on thyroid. Very seldom do you see testing for autoimmune. And so if you look on the internet for autoimmune diseases and thyroid, the numbers are low, but that is because doctors are not testing for it. I always ask people to go back and get a test done for TPO antibodies and anti-thyroid antibodies. And here you see the evidence is ignored. Clinical studies are out there. It is full of clinical studies on lupus and autoimmune diseases and thyroid dysfunction. The previous slide, there was a picture of a book. The book is by Dr. Broda Barnes. He is was a medical doctor. He died about 40 years ago. He wrote his book called Hypothyroidism, the Unsuspected Illness. And in that, he has a whole list of autoimmune diseases directly linked to thyroid. And people ignore that. Things like Raynaud's, things like scleroderma, arthritis, rheumatoid arthritis, all linked to thyroid, and people go undiagnosed. So we have to truly be proactive and take supplements. And I understand that supplements are not covered by your insurance. I recently learned that some of the Medicare type programs include vitamins. Well, these are vitamins that you buy at Walmart. If it's not food, it doesn't feed the body. A synthetic vitamin E that you're taking literally removes natural vitamin E from the body. It's a chelation effect. It is the synthetic replaces the natural, but you can do it the other way around. You can take a natural vitamin E and replace the synthetic that's in the body. And everything says natural, even if it is synthetic, because that is the way our government or FTC, FDA, that's the way they operate. They don't understand synthetics except in drugs. So we need to be educated. Thyroid disorders may cause the early onset of menopause, even before age 40 or in the early 40s. I personally was through menopause at age 42. I have seen people that were through menopause at age 38. Nothing is said about that. It's just, oh, that's normal for you. Your body just does that. Well, there is an underlying reason why you're going through menopause so early. You look back at previous generations. I know women that had babies at age 48. They were still childbearing. So with every generation, your thyroid function gets worse. Women are also being treated for menopausal symptoms, when in reality, they are struggling with hypothyroidism. Hypothyroidism can cause everything from sweats, because it affects your blood sugar, to hyper, your body is going at a hyper state. You are hot. You think you have hot flashes. Well, your thyroid is just overproducing because there are problems in your environment. As we age, your thyroid gland becomes flatter. It reduces output. So for example, I work with an endocrinologist in Europe. I did urine testing on myself because as a naturopathic doctor, I do not have access to prescription thyroid. Even if it's a natural thyroid, I do not have access to that. So I actually have to start working with an MD to get a natural thyroid prescription. And 20 years ago, I was diagnosed by an endocrinologist that I had 15% active thyroid. Yet my blood work says everything is normal. Well, how did this miracle happen? This miracle did not happen. It is just the numbers are adapted to the aging population. Doctors are not trained at prevention. They merely go to lab reports. You see, your lab says this, so you need B. Your lab says that, you need C. I don't know why they spend so much time in medical school, because they do not learn to listen to the whole person. You can see quickly. I had a young lady in my office yesterday with a horrendous goiter. And she says, I go to the doctor because my fat neck, I'm so self-conscious, but they cannot find anything wrong. That goiter needs food, that thyroid needs food. A heart that becomes enlarged, it just needs food. It is exhausting itself, enlarging, trying to function. Food is what makes the body go around. God made your body to live on nutrients, not on chemicals and synthetics. So we need to be aware of our body. Look at yourself. Do you see lines in the neck for low thyroid? There is so much to do with autoimmune, and it is a virus. Your body just doesn't start attacking itself for no reason. There is a virus in the body in many cases that we need to eliminate, and it is not an overnight result. Health takes commitment, takes quality. I hope you got something out of this. I so appreciate your time. And thank you so much, Amita, for giving me the opportunity to share my heart with the other people out there.
You're welcome. So what would you recommend? You talked a lot about the issues and the problems that we're having, and the doctors are going by the lab reports. Could you give us some kind of for our viewers, like what is the recovery path? In the sense, like what is the path to healing, right? So you talked about you have to take supplements, food. Could you elaborate a little bit on that path, how one can start the healing process?
Absolutely, because we are in such a what I call drive-through mindset, to get that quick fix. When you take an aspirin for a headache, the headache goes away. Healing is not the same process. So the way I explain it to people, when you're born, you're on the mountaintop and you're supposed to have your best health. Life and environment take you downhill, and now we're in the valley and you're trying to get help. It takes 3 months to heal anything in the body, plus 1 month for every year that you've had a condition. So it is a reversal of the pathway that you came down to try to get back up on that pathway. So for example, say you've had, lupus for 10 years. Well, give me 3 months plus 10 months that you've had for the years that you've had it. That does not mean you don't get results sooner, okay? That you don't start feeling better sooner. But in order to reverse and heal the body, it takes time, because we rebuilt every cell in the body with proper nutrients.
So what would be the key ingredients, in the sense? Would it be food, lifestyle, supplements? I mean, what would be the key ingredients for you to have someone start with the recovery process for lupus, as an example?
As an example, all disease begins with inflammation in the gut. So gut health is number one, and just a probiotic is not going to do it. I run labs in my office, and most women have heavy metals in their body. Matter of fact, I've not seen a woman without heavy metals. So when you're dealing with heavy metals, these are obstructions, roadblocks, so to speak. We've got to clean these things out of the body. Your hormones are messengers. It's a messaging system that sends a message from here to here, and these from here to here. And so it keeps going so that the body can keep working. When you have heavy metals in the body, we have roadblocks. So I cannot properly and completely heal the body without first the detoxification and gut health process. So that's where I start. I have people check pH. We take pictures of the iris, iridology that's called, and I see underlying and genetic problems there. And so I put that together. Stress is a doozy. We all know that there is so much stress, especially right now, and stress taxes your thyroid and your adrenals. So we need to reduce stress, lifestyle changes, food changes. I do recommend, for those that want to get started, a lifestyle change in food. It's called Eat Right according to your blood type. I've been using this for many, many years, and it is 90% accurate. Not 100%, but it's 90% accurate, and many people have had good results with that. For example, people with a B blood type, they want to lose weight. If they eat chicken, they cannot lose weight. It is just an antagonist for B blood types. So they can look that up on my website. I have a blood type diet, and they can look at foods. Stress, like I said, food and supplements. It's a combination. It's a whole body combination, because we deal with the whole person and do not treat symptoms.
Concept, like, we just interviewed an Ayurveda doctor right a few minutes back, and we've also talked to acupuncturists. I think you are all talking about the same language in a different way, is what I see it. Ayurveda talks about a body constitution a lot, prakriti and vikriti, vata, pitta, kapha, and then depending on what you are, you should eat according to that. And when I talk to a Chinese medicine acupuncturist, they also have a lot of research on, they have 4 different types of body constitutions. So you're saying based on the blood type, which is, we have based on whatever, eat according to your blood type. 4-4, yeah. So 3-4-4. So it's a similar concept from a user point of view. Is what my constitution is, whether it's by blood type or whether it's defined by an Ayurvedic or a acupuncturist, whatever. However they define, they have a different definitions, yeah. Right? So we have to eat according to who I am, who.
Absolutely. And I do use Chinese herbs, do some Chinese medicine. I spent a few years in China, because we all have the basic concept of dealing with the underlying causes of bringing the body in balance. The most complicated issues that walk in my door, sometimes diseases I have never heard of. You can't hardly find anything on the internet about it. I go to Chinese medicine, because if the body goes into harmony and balance, the body heals itself. And that is basically, spirit, mind, and body. Everybody talks about that. And I'm not that familiar with Ayurvedic medicine. I do use some Ayurvedic herbs, but
That's what I meant by Ayurvedic herbs. I don't think Ayurvedic medicine is allowed here in US, but Ayurvedic herbs, yeah, ashwagandha, things like
Yes,
that, right?
absolutely. And ashwagandha is one of them that helps with thyroid and adrenals. It's an adaptogenic. It helps the body to reduce the effects of stress that we're under. And that's what I said. Stress is such a killer. People just don't realize, oh, I'm trying to manage. I'm doing meditation. I'm doing this. I'm walking. That is all wonderful. But if you do not give food to that nervous system, it still wears out. It's like having Siamese twins and feeding one head. The other one is going to die. And I always compare, the thyroid and the adrenal issues to Siamese twins. It's like one body and two heads. They are so connected, and we have to take care of both of them in order to get health.
So you said like a 3-month process, right? Approximately. That's what you said earlier.
3 months. 3 months to heal anything, plus 1 month for every year that you have had a condition.
Got it. Yes. So you talked about the detoxification. You said most of the problems are related with the gut, and there's some heavy metal. So what is on a very high level, what is the detoxification process or procedure on a very high level for our viewers? Like what does it entail when you say detoxification?
Okay, detoxification. So I use supplements for that because you cannot detox without supplements. And, one of the problems, matter of fact, I was just sending somebody a message this morning in my support group. She has a friend with high levels of heavy metals and mercury poisoning from dental fillings. You cannot detox the body if the body doesn't have energy to detox. People talk, oh, you're going through a healing crisis. That is unnecessary. If you provide the body with energy to detox, it can do the job. If you don't have the energy at cell level, you can clean your car all day long, but if you don't put fuel into the car, it's not going to run. And that's the bottom line, is that we have to give the body nutrients so that it can detox. And then we can give it the detox ingredients to pull out the heavy metals, to start healing the leaky gut, because low thyroid also is related to overgrowth of candida and yeast. There's research to back that, because we have lowered immunity due to lower thyroid function. It's such a big picture, Amita. It just involves a lot, and people just take a pill of levothyroxine or Naturopathic or whatever, Synthroid, whatever they're taking, without taking a look at the whole body and supporting the system. To heal, you have to deal with the whole body. Spirit, mind, body is all interconnected. There are good supplements available that can heal the gut, that can reduce inflammation, so that we can start functioning, because 60% of your immune system is in the gut, and 80% of your brain is in the gut.
Yeah, we have a question. So thank you so much. Okay, the question is, could you please, to the blood sugar sensitivity that occurs, could you please talk about, I think, the blood sugar sensitivity that occurs during perimenopause, that's before menopause? Are there simple interventions at point of perimenopause, symptoms onset that occurs during the menstrual period, and how that compares with perimenopause? So there's a blood sugar sensitivity that happens during pre-menopause. So what they're trying to understand is if there are any simple interventions at the point before the menopause, start happening, the symptoms start happening.
Okay. So again, it takes. Let me draw a little picture here. So you have glucose in the blood. Here are thyroid hormones. I say I have, and I'm just going to tell a little story here, so to speak, an analogy. I have 10 glucose molecules, and I have 3 thyroid hormones to move that glucose out of the blood into the cell. So that leaves 7, 8 glucose molecules. It takes thyroid hormones to move glucose from the blood into the cell. If you don't have enough, the glucose is going to go too high. Hypoglycemia, or low blood sugar, is a precursor to diabetes. As we age, the thyroid produces less hormones, like I said. That affects menopause, early onset menopause. Blood sugar, the key in America is breakfast. Everybody that comes in, I ask, what's the most important meal of the day? They say breakfast. Like the lady yesterday with the goiter. What do you eat for breakfast? A cup of coffee. If you don't eat protein for breakfast, you cannot stabilize blood sugar. You need to take in 20 to 30 grams of protein within 45 minutes of arising in the morning. And
Wow.
protein, yes. And that is the key factor to stabilizing blood sugar. And Americans eat cereal, toast, bagels,
All kind of junk.
carbs.
Good
Yeah,
morning. Sorry. Yeah. We all do that sometimes. Yeah.
yeah. And so if you don't eat, your hormones that wake up in the morning as the sun comes up go into your bloodstream and they look around for fuel. And the fuel available in your body sends a signal to the level of thyroid hormones that are necessary to run the engine to get through the day. There is no fuel in the blood. The pituitary gland tells the thyroid gland, you don't need to work today. And your hormones are not produced. And America is breaking down from mere lack of nutrition.
Yeah. And then there's a follow-up question to that. Are there any herbs that help reverse hypothyroid that have persisted for more than a year or two, or is your go-to always using the synthetic thyroid hormone to start for life?
I do not use any synthetic hormone thyroid at all. I don't believe in synthetics because the body is not made to run on synthetics. I use nothing but food. Herbs are food. You know, parsley is a diuretic. You can get it in the grocery store. So I use food. Hypothyroidism is fairly easily managed. Sometimes, and I don't know who is listening, so I have to watch what I say here. I don't know if I have any medical personnel, but
our sessions are a lot of people listen after the recording, so we should assume anyone can listen.
Yeah. Personally, if I give people thyroid supplements and they are already taking thyroid medication, I tell them a week before you get your blood work done, get off the supplements. Because according to blood work, all at once, oh, now you're hyperthyroid and we have to reduce your medication when you really are not. Yeah. So that's why I just said that. It's kind of manipulating the blood work, but that's the only way people can get help. So we add to what you're already getting. And I do not recommend synthetic, but I recommend natural desiccated thyroid that the body can recognize as food.
Any more comment on a follow-up comment to your answers? You're welcome to put it in the chat window. And thank you so much for waiting. You've been very patiently waiting for 15 minutes. I know we were delayed. So, okay, that was good. Thank you. All right. So, okay, anything else you'd like to add, Dr. Wetzel, before we wrap up? This is an excellent session, by the way. Excellent.
Thank you very much. It is my passion. Everybody says you just glow when you talk about thyroid because, you know, ever since childhood, it's been a struggle. I can go back to elementary school as far back as I can remember as a child. And, you know, I had one bowel movement a week. Constipation is the first sign of low thyroid because your body is not processing, it is sluggish, and yet everything is always normal. You know, it was not till I became an adult, and back in the day used to drink coffee, which of course is bad for your adrenals, but then I started going once a day. And now when I tell people, you know, if 3 trucks go into a tunnel, 3 trucks need to come out the other end, they look at me as like, 3 times a day? You know, every time a baby eats, a baby goes because the system is still working. So right. Prevention is key. Educate yourself. Get on some quality supplements. Make sure they're ISO certified. You know, people research supplement companies, but they don't know what to look for. NSF certifications, ISO certifications. They can put anything on a label these days because the government doesn't want you better. So take care of yourself. Educate yourself. I am here. Obviously, Amita is here, and thank you so kindly for putting up with me and my lack of technology knowledge. There are people that want to help you, but ultimately it's your decision.
No, and we have another question. Okay, so before if someone has perimenopause in their 30s, oh my God, that's crazy. Is there a high likelihood menopause will occur a few years down the road versus other women who may experience it in their late 50s? So
is there a, I'm sorry, I couldn't, is there a what?
So someone has hypothetically a perimenopause issues in their 30s. So the question is, what are the likelihood the menopause will probably occur a few years down the road versus in their 50s? So in other words, if they start having symptoms, perimenopausal symptoms, when they're still in the 30s, they're probably going to hit menopause, I don't know, I'm just making it up, in their 40s as opposed to in their 50s, which is a natural age. That's the question. So
yes, absolutely. And that is related to low thyroid. That's what I was saying earlier. I know people who've gone through menopause by the time they're 38. So you may not come up with any thyroid problems when you go to the doctor, because again, you are normal, like the average person who goes to the doctor. But that is definitely a symptom of low thyroid, and you can support that system, but you cannot just take a thyroid supplement without ignoring the system that it is attached to, because you probably cannot even convert those thyroid hormones in your liver, in your kidneys, in your small intestines, unless you're taking care of the whole body. You can hold things off, you can have a quality of life, and you can reverse things. It takes commitment, energy, time, and yes, it does come out of pocket.
Yeah. Hope that answered your question. Let us know. Okay, thank you. All right, any more questions before we wrap up? And these are educational sessions. I didn't say it in the beginning. I want the sessions to start. I don't want people to wait for me to say all kind of things. So please don't take it as a medical advice. We are bringing educational sessions every week. We are trying our best to bring you the best of the best from all over the world. So you educate yourself and help us share our sessions if you like them. Okay, any final comments? Any final comments from audience? Okay, your closing comments, Dr. Wetzel, before I wrap up?
Well, I think we're going to do another session next month, Amina, that you mentioned. So we will do a little bit more of an in-depth workshop. I look forward to helping those that are looking for help. And please know that the power is in your hands. And I appreciate your time.
Thank you so much for being with us. Thank you, everyone, for watching us. Have a great weekend. Bye now.